Post-baby breast. There is a lot to unpack there. If you had a book that had multiple chapters, you could just list the complaints that women have with their breast after pregnancy and breastfeeding in that book, and it would fill up the entire book, okay? I mean, it is a huge problem. It's something we see in our clinic every week, and we get it. Volume enhancement, that enlargement, has consequences on the baseline anatomy of your breast that really will not change after breastfeeding is discontinued. Too big, too small, deflated, asymmetric, really droopy, really droopy. A lot of different issues, we see it all the time. So although it's amazing, you know, shout out to moms for bringing kids into this world. It's an amazing process. It's not amazing what it does to your breast. With all that said, we want to empower you. So take a look at this video. It'll talk about why your breasts are the way they are. Secondly, what surgeries we do. And we actually talk about the surgeries, and I show you some footage from surgeries, some pictures, et cetera. And then recovery. It'll be really helpful for you if you have post-baby breast and you really want surgery. And yes, all these surgeries have scars associated with them, and yes, scars do heal, and yes, they will fade away and not be a problem in the future. So, check it out. So there's three different reasons why your breasts look the way they do after pregnancy and breastfeeding. The first thing, and probably the most important part, is the ligaments that hold your breast together when you're young, before pregnancies, that really give it that youthful shape, get stretched out with pregnancy. And why is that? Every mom knows why. Your breasts enlarge with pregnancy. I've had patients come in, their breasts have enlarged 3 or 4 cup sizes. And sometimes that's a good thing because they didn't start with much. But in reality, that stretching process, that expansion process, especially with engorgement and breastfeeding, stretches out those ligaments. And there is no amount of diet and exercise, lifestyle changes, even if you have someone at the gym telling you that you can do chest work and that's going to help your breasts, it won't, unfortunately. I wish it did, but it won't. So that's part of pregnancy and breastfeeding. The second thing that happens, and this is pretty consistent with all people going through pregnancy and also with aging, the kind of fibrous tissue of the breast, that tissue that's real strong of a youthful breast, gets replaced by fat. And if we all of us know, if you grab areas of your body, and I always grab my flanks down here, if you grab areas of your body that are full of fat, they feel jiggly, they don't feel like they have a lot of strength and consistency. And that's what happens with your breasts. By the way, post-pregnancy, women gain weight, they're gonna gain it in their breasts because they have a lot more fatty tissue there after pregnancy. The last thing is the skin. The skin gets stretched out. That deep layer, the dermis layer, gets stretched out. You get stretch marks. The areola enlarges. The areola becomes asymmetric between one side and the other. So that expansion process really destroys the deep layers of the skin, the dermis of the skin, and you get these stretch marks even with external treatments probably won't go away. Those are the three things: the ligaments, the kind of increased fatty tissue in the breast, and the stretched out skin. Those are three things that really will not go away after pregnancy, even with weight loss. If you want an example of that, just take a look at this pre-picture. This patient was doing great. She's post-pregnancy, of normal weight, works out. She's really in a good place in her life, but her breasts were just deflated. A big part of the presentation for post-pregnancy breast is the upper pole. Above your nipple and areola, that space between your neck and your nipple tends to get flattened out or even like depressed, like it has a concavity to it. That presentation is really universal in post-pregnancy breast, even for people that have enlarged breast. When you do surgeries to correct post-pregnancy breast, post-baby breast, then you're filling in that area above the nipple and areola to give it a more youthful appearance. All right, the next thing we're going to talk about is the surgeries. The surgeries themselves are amazing. We can do reductions, we can do lifts, we can do reductions with lifts, we can do fat transfer, as I said before. There's multiple different options that we can do for your breasts to make them look better. All right, surgeries. Surgeries for post-baby breasts. They all kind of take the same approach. It just depends on your presentation. So you're either going to do a reduction because your breasts are too big, a lift because they're too droopy, or add volume with an implant or fat, your own fat, okay? And that would be a breast implant. Now, there's a lot of mixture in between depending on your presentation. By the way, most women that present with enlarged breasts after pregnancy also have droopiness, so you do a lift and a reduction at the same time. Women that have droopiness usually don't have enough volume to add volume back, or residual volume left below to add volume back above in that area of deficiency we showed you before. And so most cases you do a lift with an augmentation, which we call in plastic surgery parlance a mastopexy augmentation. You can also use fat in that area too. So it just really depends on your presentation, but let's go through the surgeries real quick so you understand the approaches and the risks associated with them. So first, breast reduction. We use two different approaches. You can take a look here, a vertical approach, which is like a lollipop incision, and then an anchor incision, which is we call a wise pattern approach. That's what we call it in plastic surgery. Either way, it's great. Depends on your presentation and which approach you can use. Obviously, most women like the less invasive approach or shorter scar approach. And you just take out breast tissue. Now that breast tissue is removed primarily below the nipple and areola and on the outside of the breast. You want to keep as much of that breast tissue above. The sensation to the nipple and areola should be maintained and maybe a little bit less after these surgeries. Breastfeeding may be hit or miss, so hopefully you're done with pregnancies if you're consider the surgery. The surgery itself takes about 2 hours, sedation, sometimes general anesthesia, and when you wake up, it should not be that painful. Breast lift uses the same approaches as a breast reduction. It just, again, depends on your presentation. Most breast lifts can be done through a vertical approach. That's that vertical incision around the areola and straight down the midline of the breast. And again, same thing with the sensation to the nipple. The amount of time with surgery, it takes about 1.5 hours, 2 hours, and it's not really that painful when you wake up. Breast augmentation. Breast augmentation is only 45 minutes. It's amazing. So let's take a look at that picture we showed you before. You can see she's deficient. Where is she deficient? Again, in the upper pole. And we felt that she would be an excellent candidate for breast augmentation surgery. We picked a very conservative size implant, and here is her after. Pretty remarkable change. So you have to understand with breast augmentation, you can put implants above or below the muscle. In this patient, and in almost all cases, we put it below her muscle. And let's take a look at a couple pictures from the operating room. This shows you that she's laying on the table. She's prepped and draped. This is how we sterilize the skin. The next picture shows you a small incision at the base of her breast. There are 3 different types of incisions with breast augmentation: at the base of the breast, around the areola, and also in your armpit. We chose the base of the breast incision. Next thing we did is develop a pocket underneath the muscle, and we do that very carefully. Transferring the breast implant into that submuscular pocket, we use something called a Keller funnel. This is to make sure that we do not touch the implant, that it remains sterile. The implant also is soaked in an antibiotic solution. Once it's underneath the muscle, we do the same thing on the other side, sit you up, close the incisions, and then you're done. Pretty remarkable change, 45 minutes. Now, breast augmentation can be a little uncomfortable when you wake up, so we do give you medications beforehand. You wake up and you don't feel a lot of discomfort. If you want volume or you need volume, and you do not want a breast implant, and we understand why. Listen, breast augmentation is not permanent. We tell our patients all the time that maybe you'll get 10 years out of it, maybe, okay? So if you sign up for a breast augmentation, you're signing up for lifelong surgeries. And that's something you need to really consider before you do it. Now, it's not saying that's a bad thing. Replacement surgeries are fairly easy to do. It's not that much of a problem. But if you don't want an implant for whatever reason, you can in some cases use your fat. We have a new system in our office created by Alma. It's called BeautyFill. There's another video on this channel. You can look at that device. It's pretty amazing. And we've been using BeautyFill to transfer fat from women's abdomens and their sides or flanks up to their breasts with some really, really good results. And we combine that with a breast lift. Not everyone's a candidate for transferring fat to the upper part of the breast, but if you're a candidate, you should definitely consider this option. And that in totality is all the surgeries that we do. Breast reduction, a breast lift with breast augmentation, and a breast lift or just an augmentation alone with fat transfer, autologous fat transfer. In totality, these are hugely transformative. Our patients are extremely happy, and the recovery is really not that bad. Breast augmentation is the one exception just being very honest with you, that can be somewhat painful in the first couple of days, but everything else, you tend to heal really well and quickly. So take a look at this next part. We can talk about recovery and how we treat the scars afterwards. Okay, real talk about recovery with breast surgery after pregnancy. In most cases, it's really not that bad, and that's the honest truth. So breast reduction, breast lift, breast augmentation, even fat transfer, it's fairly well tolerated. Now, the one exception is breast augmentation. That stuff hurts a little bit. The first couple days is not a walk in the park. If someone tells you it is, they're not telling you the truth. But it's only for a couple days, and we also give medications. Muscle relaxants really help. Remember, you put that implant underneath the muscle. When that muscle expands, it feels achy, you can have spasms in the first couple days, and the muscle relaxants really make a difference. But like with a breast reduction or breast lift alone, the recovery is not that bad. Surprisingly, it's not that painful. Even with reduction, I basically redo the entire breast, and it's pretty amazing. People don't have a lot of pain. So that first week, you're just getting back on your feet. You really probably can't work, you're at home. If you have kids, obviously you do have kids, you'll need help. So you'll need family or friends or significant others to help you out. The second week, you can be back at work, even if you have physical duties. So rarely do these surgeries limit you from just normal work duties, with one exception. If your work duties involve a lot of heavy lifting, greater than a gallon of milk, a lot of extension of your hands over your shoulders, especially if you've had a breast augmentation, you're not going to be able to do those duties for a couple weeks. So the second week, you're back at work, you're back basically almost to your baseline. You will have discomfort during these times, you will have swelling, you will feel uncomfortable intermittently, and sometimes it'll be hard to sleep because you can't really roll over on them because it'll hurt when you do. The third week, you can start going back to the gym. Nothing in the upper extremities, everything's kind of the lower part, the legs, walking, mobilizing, eating well, no smoking, no drinking, all the stuff you need to do to recover well. And then by the fourth week, you're almost back where you were beforehand. Breast augmentation is the only exclusion per usual. You cannot really get back to upper extremity stuff in our office at least till like 6 weeks. We like to really take care of where those implants are placed and so they don't shift around. But that's it. Long term, people worry about two things. With any of these surgeries, they worry about the scars. We have a plethora of options for scar treatments in our office, like numerous ones. And we've talked about that many times before. LED lights, lasers, RF needling, you name it. If you have a problem with healing, we can fix it, or an office like mine can fix it. If you need a scar revision, you do that in the office. It's not a big deal. So I understand, we understand your concern about scars, but scars really do heal well, and as is evidenced by our before and afters. The other thing you worry about, especially with breast augmentation, is scar formation around the implant, which is called capsular contracture. And we do have some treatments for that if that does occur, but you will be massaging those implants after surgery. In terms of long-term duration of your results, it can be indefinite. With a breast reduction or a breast lift, you're gonna have those results last for a long, long time. Now, you can't stop the aging process. If you gain weight, obviously that's throwing a lot of stuff out the window. If you get pregnant again, or if you have to have surgeries on your breasts, like for breast cancer, God forbid, these things are obviously gonna change the appearance of your breasts. But if things stay relatively the same in terms of your weight and lifestyle, living healthy lifestyles with diet and exercise, these things should last a long, long time. And that's it. Let's take a quick look at a before and after of a patient who had a breast lift and a breast augmentation. This is her before, very much deflated. She is a very small person, minimal body fat, really small frame, and she just wanted a very conservative breast augmentation with a lift. And that's what we did for her. We did an implant that was around 275 cc's, did a vertical mastopexy. You can see the scar here at 1 year is amazingly healed, barely visible, and she has a huge improvement in her breasts. Nipple and areola look better. We also did a tummy tuck on her too. This just shows you the possibilities. It doesn't have to be this gargantuan implant and huge lift and big change. You can just go back to where you were before, and that's what we specialize in our office. Another example is this patient here. she was very much deflated. Now she was larger, had a larger frame, was taller, and she wanted more volume in her breasts, and that's what we gave her, both a breast lift and a breast augmentation. Here's her after. It's amazing. It's an amazing transformation. Clearly, this is bigger, more prominent, more visible, but that's what she wanted, and she was very pleased with those results. And then the lift was completed with a vertical, what we call mastopexy. And again, the incision is around the areola and straight down the midline of the breast. This heals great. If you have post-baby breast, and by the way, a lot of women have post-baby breast, don't fret. There are answers. Most of those answers are surgical, and some of you do not want to hear that, but that's the reality. These surgeries work really well. Done correctly, management of the scar, management of your scar afterwards that's done with diligence and all these different treatments we talked about, your results are going to be amazing. You're not going to regret your decision. So, if you're struggling, consider these surgeries. If you want more information, go on our YouTube channel, check out our Beauty and the Surgeon podcast feed, and you can see tons and tons of episodes there about mommy makeovers, about post-baby breast, and a really good episode that I highly recommend is about implant selection, so you can empower yourself before you go into the plastic surgeon's office and have to select an implant.